Yeah, if it's narrowing, it's natural process, the body is fixing it, so it can be, absolutely can be enhanced. Mostly, obviously, well, guys, you give me an answer. Which technology is better for closing the hole in the heart? The Kossmotic, yeah, narrowing. So, heart regenerates really well if you give it a chance. You can do it mostly with Kossmotic technology, and we have a very interesting cases actually with congestive heart failures, where we had a gentleman who was given 6 weeks to live because heart was failing so bad, and they get back to normal. He's still alive. It's 3 years later, and it was very successful. And congestive heart failure, as you know, it's pretty difficult things to treat. So hearts do regenerate even in hopeless situations. And especially when it's not hopeless, absolutely, you can manage, you can trigger the heart regeneration, as well as liver regeneration, or sometimes pancreas is more difficult, but you can do that. The bone is age-related degeneration of the bone, correct? If the meniscus is completely out, and we are talking about the knee here, if the meniscus is completely out, we didn't have much success with that.
No,
but if the meniscus is still a little bit of it left, yes. Because there is still a structure there that can, actually the body can see what is needed.
Because
with the scanner technology, it's very interesting when you have the organ which is symmetric. Like you have two knees, right? So you can treat the other knee as well, the knee that is not affected, and show the body will see how it should function. And then it will help the one that is suffering to restore the structure. We actually grow meniscus knee meniscus pretty successfully. It doesn't happen quickly because it's a cartilage, it's difficult to regenerate tissue. But give it about 3 months, and yeah, we can do that.
Thank you so much.
Coronary artery disease, coronary blockage.
Coronary blockage. With coronary blockage, we don't touch that because what you have here is a narrowing of arteries, and you don't know if there is a blood clot there or not. We're a little bit concerned about blood clot being disconnected from that, so we don't really directly work on the blockages. We work around it, and in some cases it does the job, sometimes it doesn't. It's not 100%. How? 62.
62.
62, okay. Well, you still can try, but I wouldn't work directly on the blockage. I would work around it. As well as on other places where you have blood clots.
As you said, the cosmetic is the regenerative medicine. As you said, the congestive heart failure. So any study for confirmation the cosmetic using in congestive heart failure when the heart function is below the 35% ejection fraction?
25%?
25%, even 35%, less than. If normal heart function is the 50 to 60% ejection fraction. So any study, comparative study, show the cosmetic really worth in role of treating the end stage heart failure? Hopeless persons?
There are not many studies as such have been done on Kossmotic, like the comparative studies, because the Kossmotic is such a new technology. But whatever they did, I don't have the statistics for heart failure. We have only single anecdotal cases. The site of Let Medical website, it contains all the histories and all the research has been done. So I can give you the website so you can go and see which research has been performed.
Yeah, what about the kidney problems?
Kidney problems. Well, kidneys are actually responding pretty well. Kidneys are an interesting organ, and we do. Of course, it's never a single treatment. It's never a single modality. When you deal with chronic problems, you have to supplement it with something that will dissolve the stones and help the sand to go. But when you deal with kidneys, and especially kidney stones, what you will observe, probably on the second day or third, you will start passing sand. But the sand will be interesting. It will be just with the gallstones, the same thing. If you look at it, it will be almost in like a fatty cover. So the sand will have the fatty cover around it for easy passage. We very commonly use scanner and Kossmotic for the kidney stones when they're passing. to make them pass easier. And for kidney regeneration, it requires time, but it can be done.
What about the diabetes?
Um,
Both the types of diabetes.
I will, for kidneys, about 5-6 months. So it's not fast.
No, diabetes.
Huh?
Sugar.
Oh, diabetes.
Insulin, yeah.
Diabetes. Yeah, with diabetes, another interesting thing. So with diabetes, you have to work on a pancreas, of course. And with the diabetes, we can kind of run into problems when it's diabetes with insulin dependent. When we have insulin dependent something, you don't want to go in a conflict with a medical doctor who is prescribing the insulin, because they're afraid to take a patient off the insulin, and the client is afraid to get off the insulin. So in this case, if the insulin is still introduced to the system, very difficult to deal with it, because the pancreas gets lazy. Why should I work if I get insulin from the outside? Why should I bother to produce my own insulin if I can have something from the outside? So in this case, we usually suggest to slowly, gently challenge the body and put insulin just a little bit down. So the body kind of feels the challenge, but it's not too much. What we observe in a case of diabetes, after about 3-4 sessions, you will have a spike in the sugar level in the bloodstream, and almost invariably. High spike of the sugar level. And we always tell people, don't be afraid. If you feel good, if you feel fine, and in most cases, clients keep feeling fine, it's just sugar level is high. Don't bother about it. Don't worry about it. Keep going. Because what the body is doing, it's challenging itself. It actually spikes up the sugar level so it can remember the mechanisms to put the sugar level down on its own instead of taking insulin. It learns to produce its own insulin, but it all has to be done in controlled environment when you're actually supervising a client. You cannot just let the client go on its own and deal with that, because as soon as they see the sugar level high, they will immediately take huge amount of insulin, and everything you've done until up to that moment will be wasted. So it has to be in a controlled environment with a skillful therapist who knows what they're doing. But that's actually, it's not only with the sugar level, it's with the liver enzymes as well, would be the same thing. All of a sudden you see the levels go sky high, and they will go down in 2 or 3 days, but the body needs a time to process the information and remember its own internal mechanisms of putting things back to normal, restore homeostasis.
Thank you, Dr. Irina. I just wanted to add to it, because his question was if we have some studies. Yes, Russian scientists have done a long study of 5 years for diabetes 2. They studied H1ABC, H1BAC, whatever it is.
BAC.
I'm a little confused. It was a long coherent study, and they were able to they claimed that they were able to successfully cure diabetes type 2, which is a genetic diabetes, and that diabetes didn't recover in 5 years with the treatment for 1 year. And this was done with a low-level laser. I don't remember what the generic name of that laser brand was, but this study has been done, and there are a few other studies also for diabetes and high blood pressure-like diseases too.
Dr. Renew, she is a researcher, medical researcher, so she knows what she's talking about.
Ma'am, it was a great presentation. Thank you very much, first thing. Second thing, can this be used on people who have pacemakers or something electronically? Because this is giving electrical impulses, basically. So can we use it on patients having pacemakers and things like that?
Yes. Officially, if you would look at the instruction booklet of the book, you will find that pacemaker is the contraindication for treatment, but just because it's an electrical therapy.
Yeah.
In reality, we always take the consent of a client, and we always use it on the clients with the pacemakers. Just don't put it right on a pacemaker, just walk around it, approximately on that area, so don't touch this area. You can do the rest. It does not affect pacemakers, no. Electrical impulse of the scanner only goes 0.5 millimeter inside the skin, only 0.5 millimeter. The rest is pure information exchange, so it does not affect the electronic devices.
Do you have any negative experience or any experience that with this one that it should not be used
No.
in such cases or anything like that?
We would be very concerned about clients in an emotional, not in a good psychological state, or intoxicated clients on drugs or under alcohol. We would be concerned about that generally because you have to work very closely with the client, so you don't want any kind of problems. But other than that, no.